Welcome to the Chiropractic and Legal Injury Podcast, recorded live at our events. We're here bringing you the expertise, insights, and tools you need to navigate the world of personal injury care and to uncover what you didn't know about car accidents. It's no accident you're listening today, so let's get started. Welcome to the Chiropractic and Legal Injury Podcast. We are recording here live at the Chiropractic and Legal Injury Conference in beautiful Scottsdale at venue 8600. My name is Ashley, and we are interviewing Dr. Lee right now. Welcome to the show. How are you doing today?
I'm doing great. Thank you.
Yeah,
I'm excited to be here.
Bright and early. Yeah. Well, tell us a little bit about yourself, about your company, where you're located.
Okay, well, we are Arizona Digital Motion X-Ray, and we are located in Mesa, but we are a mobile service, so we actually travel across the valley. And I'm actually partnered with my son. He's my business manager and partner.
Shout out.
Yeah, he manages all the stuff that I'm not really interested in business, and I get to be the clinical side. I get to push the button and watch things happen. So
Yeah.
I don't know why, but I think I have the exciting part, and he has the boring part, and it works really well for us. So.
And he's really good at his part.
And he's great at his part. Yep,
Shout out to
absolutely,
him. He's
yeah.
great at his part.
It's fun to be a father and son team. I like it.
Yeah, that must have a really unique dynamic.
Yeah, yep. I get to call him at all hours of the day, even if it is 2
Morning,
o'clock in the
night.
morning. Yeah, not offend him. So.
Oh my gosh.
Oh, maybe it does offend him, but he's my son.
Yeah. Your family.
Yeah, family.
Absolutely. And you're actually speaking later on today.
I'm speaking later on today. Yeah, and we're going to speak about upper cervical instability.
Awesome. I'm really looking forward to seeing it. I'm actually going to hopefully try and sneak in and watch it as well, because sometimes when I'm recording, I'm not able to go see, but the talks are always interesting, and there's always pieces of information that you get, even if you see the same thing over and over again, that you didn't get the first time or the second time, and it's just...
And upper cervical instability is extremely common. It's more common than we probably realize.
Really?
Oh, absolutely.
Wow. Are you going to talk about it in the talk, right?
Yeah, we'll talk about it.
All right.
Yeah,
Awesome.
Exactly.
So I do have a couple of questions here.
Okay.
The first one is, one of the conference's goals is to kind of facilitate better understanding and collaboration between providers. How does DMX imaging contribute to a more accurate diagnosis and better outcomes for patients in personal injury cases?
This is a great question because obviously when you have any sort of trauma to the neck, a lot of people are familiar with the phrase whiplash, which is going through an acceleration and deceleration and so forth. There's a lot of trauma that occurs to all those ligaments up in the neck, actually the whole neck, but specifically up in the upper cervical portion. And that's where a lot of things happen. All your vitals are controlled there, so a lot of your blood vessels that goes up to your brain are all in that area, and you get some trauma and some damage to that, and it can really create all kinds of symptoms and problems for the patient that can be very confusing.
Yeah.
Now, one of the challenges with just doing standard imaging, ours is dynamic. You're going to see the patient move through their full range of motion, and we kind of push and stress it through the in ranges. Mm-hmm. When you have that kind of trauma and you have that kind of pain to that area, you're going to get patient guarding. It's just normal. The patient doesn't want to go through that pain.
Yeah.
Or if there's a sense of instability where the patient's going to feel like it's going to hurt them more, they're going to pull away and it's going to guard. So the challenge that you run in with static imaging is even if you were to try to do the same positions, the timing it takes to set up the patient, get around, and then push the button to get the x-ray, the patient may have already shifted or moved to make themselves feel more comfortable. And that comfortable position is not the position we're looking for. We're looking for the position that actually causes the most deviation. Where is the most damage? What ligament is damaged? Where is it damaged, and how severe is it damaged? And digital motion x-ray, because it's in real time, you get to see the patient when they actually do it before they have a chance to guard.
Interesting. That's so fascinating, and being able to, as you said, capture that moment. I definitely know if I'm hurt or my neck hurts or anything like that, I definitely try and protect it and not move into that.
Exactly. I mean, patients protect their neck. That's you live in your head. You don't live in the rest of your body, and
That's
so
true.
you're going to try to protect that. So.
Yes, all of those brain functions. We definitely need those.
Right?
Absolutely.
Yeah. It's kind of hard to live life without them. So.
Absolutely. Is there something really unique or kind of crazy that you found on one of the images that maybe you weren't expecting or they weren't expecting?
Yeah, actually, one of them that I've run into that was surprising is instability a lot of times shows up with all kinds of symptoms. And I can almost predict I'm going to see an instability on this patient based on their symptoms and everything they've mentioned. I had one that really threw us for a loop. It wasn't an instability. It was something a little worse than an instability. Well, I shouldn't say worse. It's different, but a completely different problem I would have not thought of. And that was the patient's head actually, during that trauma of an auto accident, was shoved forward and then it was jammed there. So when we went through the ranges of motion, yeah, she did have some instability in other areas, but where I thought she was going to have instability, she didn't actually have instability. She was jammed in a odd, locked up position, out of joint, and it was just kind of stuck there. Now here's the part that blows your mind. She had MRIs, she had X-rays, she had CT scans, all negative.
Didn't show up.
No one saw anything. I'm not sure why that was the case, because that one should have probably been seen, but no one saw it. We get in there, we have her move, and we see that joint doesn't even move. And it wasn't because of any sort of degeneration or fusion that occurs, because sometimes that'll keep a joint from moving.
Yeah.
It was because it literally got lodged too far forward and stuck there.
Wow.
Blew my mind away.
That's a crazy story.
Yeah.
Was she also surprised about it?
Yeah, and of course that's actually, I would rather see that, because that's more of an easy fix than instability is if you have instability. But yeah, very similar symptoms, but hers was actually stuck.
So what are some of the most common symptoms that kind of indicate?
Well, the most common, and right now on the internet you can hear things like CCI or AAI, which is cranial cervical instability, or atlantal axial instability. Those are right at the very top. A lot of those produce the same kind of symptoms.
Okay.
Because you're hitting those vital structures, you're going to hit the vagus nerve, for example. That's one of the cranial nerves in there that controls your breathing, your heart rate, and so forth. But you're also in that instability, and we tend to forget that, and this is what I'm going to be talking about also in the seminar, is you've got these little holes running through your cervical spine where the little vertebral arteries run up. Those guys run up, they curve up underneath the skull, and then they go through the little hole that goes to your brain, right?
Okay.
So right at the base of your skull, you have this network of vascularization that feeds all of the base of your brain. That comes from those vertebral arteries. So if you start to get a shearing occurring in those little holes, you've got two holes and you start to pull them apart, that center hole is going to get smaller. And that little artery inside of it's going to get pinched and pulled. When that happens, you're going to cut the blood supply down to all of that area.
Wow.
Now, all of that area no longer can function. You know how you get a numbness and tingling in your arms when you've maybe laid on it wrong or something?
Sure.
Imagine your brain going through that. So all of a sudden, your brain is not getting the blood supply it needs. That's the brain that feeds the balance, brain that feeds vision, recognition, things like this, parts that that control your heart rate, your breathing. So now you get heart palpitations, you get shortness of breath for no darn apparent reason, and it's simply because you have some sort of instability that compresses, and that's just the vascular side. We also have a neurologic side. Those nerves also can get pinched and create problems as well. So you got a double whammy from several different angles that are going to create symptoms like headaches, vision problems, fatigue, lightheadedness. I'm trying to think of a few other words off the top of my head. There's a whole bunch of lists. I mean, and really what's interesting is the brainstem, where all this is happening. You've got all these tracts that feed the whole body. So sometimes we've even seen some really random stuff. Hey, today my big toe really hurts bad, but now tomorrow it's my right arm that hurts. You know, you see patients that get these really sporadic sort of symptoms. Yeah.
How bizarre. And it's all that same injury.
It's the same area. It's just, however, that instability is shifting. So if several ligaments are damaged, you're going to have instability in several different directions of that same joint. So, the upper cervicals have a whole bunch of ligaments up there controlling various ranges of motion. So if you have several of those damaged and overstretched, you're going to have that shifting all kinds of places. And whatever tract happens to get hit, you're going to have some sort of compromise for it, and you get some symptoms from that.
Wow.
Yeah.
And you did say you were mobile, right? Do you find that being mobile really helps patients just get the care that they need, or be able to come to them, or whatever the area is?
It works out really well. I actually see a lot of people out of state as well, and so I tend to so I'll tend to drive over to the airport and meet them over there in that area, do the Digimotion X-ray, and they fly back home.
Valet
so that
service.
almost valet service. It works good because we're the only provider in Arizona doing the motion X-ray, and it's a pretty large state. Yeah. And so this allows us, we pick different areas of the valley to park into, so we can try to see as many people in those particular areas, so they don't have to travel quite so far.
Yeah, I know that any sort of hindrance for care, right? Makes it even harder. And just every day, right? Every day, if I'm like, there's extra traffic and it makes it so much harder, you try to avoid that. So, especially in trauma, when you have all of these other things happening and you're trying to get your personal injury, you're trying to get your car fixed and you're trying to make sure you go to your doctor's appointments and all of those things. Any hindrance, if you have to drive 45 minutes in order to get that imaging, may not do it. So being able to...
And a lot of times they'll have somebody will drive them. I've actually had patients, in fact, recently I had one traveling from out of state that drove. She didn't drive here. They had the bed, it was a minivan. They had the bed laid down so she could lay down in the bed.
The whole way?
And lay the whole way because she can't even sit because the upper cervicals were so bad. Sitting created a lot of problems for her. And of course it takes us a little bit longer to do that patient because they're having to challenge the cervical spine where it's unstable. And that can be kind of scary a little bit for some patients. And so we have to kind of take it a little bit easy. And some patients come in all kinds of packages of problems. And I have literally seen some that they open up the door and they're laying in the van. And now they got to have help to even get in our van, and then we go through the process.
So being at kind of the first part of care, do you ever get to see like their recovery at the end or how they turn out or how they heal or kind of like that, that end point, that happy point where you got them back to?
That, when I have a clinic in Flagstaff, and sadly only the patients usually that I refer to myself in that situation I get a chance to see.
Yeah.
Very rarely, and I really wish they would. I always ask them, hey, give me some feedback. I try to stay connected with them even long after we've done the service. And part of the reason why is because commonly I get asked the question after they've seen the instability on their cervical spine, they ask me for recommendations. Who do they want to see?
Yeah.
Well, all I've got to go on is whatever previous patients have told me who are great or, don't see that one, do see that one, so forth. And that list is very, very tiny because very few patients actually give me that kind of feedback and follow up. But I wish it was more.
And I also feel like that end point of, seeing the recovery part is such a motivating factor to like, I'm really doing this great work and being able to help people and see things that maybe they didn't see before and validate maybe concerns. Maybe they've had something hurting for a long time and it didn't show up on X-ray and it didn't show up in MRI. And they're like, something's really wrong, but they can't figure it out. And
that is something, I'll tell you a personal story with that one. There was a patient that it was a work comp injury. Okay. And pretty much the work comp doctors told him that he was faking it. This is a psychological disorder. The work comp wanted to cut off his disability that he was on.
Wow.
And this guy was beside himself, and he says, I can't even go to the bathroom without my wife walking me to the bathroom from the couch. Oh. It was that bad. Now, sure, do patients make things up? Absolutely.
Yeah.
But this guy was also so frustrated because the medical community pretty much just dropped him. They looked at it as, and why, by the way? Because he had like 5 MRIs, all negative, right?
Wow, yeah.
And so they pretty much said that this guy was just faking it. And so he was distraught, knowing that it was going to be, his disability was going to be cut off. He was looking for answers.
Yeah.
And he found us, and basically he self-referred. He got his doctor talked into referring to us, and we did the motion X-ray on him. Not only did he have upper cervical instability, to date, he's still my worst patient I ever had. He had 19 millimeters of translation, combining both right and left lateral bending. This guy was so bad, it totally correlated with his symptoms. Now think about it. You're getting that brainstem pinched, all those vital tissues pinched. He was getting all of that because that thing was so loose, it was moving in every direction it could move.
Yeah.
And really probably needed a fusion for that one. He broke down and cried right there in my van after he saw this. And I'll tell you, the reason why he cried wasn't because I was giving him such horrible bad news. It was because somebody finally listened and somebody finally found his problem that he's been searching for years.
Yeah, that's such a powerful story, and I feel like many of us can relate, just not even being able to find the answer to whatever problem that we have or the endless fatigue or the studies or things like that, finally being able to like, this is it. This is that validation that I really was, telling the truth.
I'm not
about
crazy.
It. Yeah,
I really do have this problem. Everyone else telling them I'm crazy, but there it is.
Yeah, absolutely. Oh, wow.
We're going to be showing a video of a spinal fusion that failed.
Really?
But on X-rays, when they take the X-rays, everything looks like it's all connected together. But on a motion X-ray, you actually see the wires separating and moving away from each other because it failed.
Wow.
Now, if we're just assuming, oh, well, it's all wired shut, that's not moving. Well, you might be making a very huge mistake because maybe the surgery failed.
Yeah.
And in his case, it did, and he had to go back and get it redone.
Oh my gosh, that's incredible to be able to really see that through all the motion and not the stop images of just an X-ray.
I absolutely love seeing the things that we find. It's never a dull moment.
I believe it, absolutely. That's so crazy. So if you did have any advice for anybody who were to get in a car accident, which we live in the state of Arizona, and there are 300 accidents a day, and those are only the ones that are actually like reported or called in, right? So if you had any piece of advice for anyone who got in a car accident, what would it be?
Well, my almost initial response is get a digital motion X-ray. But in actual reality, you don't want to get one right away.
Okay.
Because acute cases, you're too guarded. And we want to see you after you've kind of loosened up a little bit. So I would say a few weeks after a motion X-ray would probably be a good time to get it. Over 3 million upper cervical injuries occur every year through auto accidents. And so, and the amount of trauma that's going to cause ligaments to tear in the upper cervicals is the same amount of trauma you're going to be able to get traumatic brain injuries as well.
Really?
So a lot of that goes along with it that gets missed. Upper cervical injuries are probably one of the most commonly misdiagnosed injuries. And part of the reason is because they can mimic so many other symptoms. Yeah. I'll give you one quick example. Yeah. POTS, which is posterior positional orthopedic tachycardia syndrome. So basically what happens, you go from a sitting position to standing position, all of a sudden your heart just starts racing out of your chest, right?
Yeah.
Well, is it truly a POTS condition, or is it because of the positioning you took to get out of your chair? Because remember, if you feel unstable, you're going to move a little differently.
Yeah.
Your head's going to shift a little bit. Is it possible that you could be cutting off blood supply or neurologic information up in the upper cervicals, which tells the heart what to do?
Right.
And the heart goes, oh crap, I better hurry and work a little harder.
Right.
And so all of a sudden you get a racing heart. So I think a lot of misdiagnosis can happen. There's people that get MS or Parkinson's. That may not be MS or Parkinson's. That may be an upper cervical instability.
Interesting.
So my recommendation going to the doctors is if you have trauma like that, keep first and foremost the thought that instability is most likely occurring in there. And now the question is, how severe is it? For the patient, it's also good to keep in mind that you had some serious injury up there. We might want to take a look and see what's going on.
Wow.
Yeah.
Well, thank you so much for being on this podcast.
You're
There's
welcome.
so much great information, and I'm looking forward to sitting in the talk later.
Sounds great.
And thank you to everybody who joined in, and we will see you on the next one.
All right, sounds great. Thank you. Appreciate it.
From all of us at the Lazzara Law Firm and the Chiropractic and Legal Injury Conference, thank you for listening. We hope you never need us, but if you or someone you love does, know they'll have a team dedicated to helping them rebuild, recover, and reconnect with what matters most, their loved ones and the life they deserve. This is the Chiropractic and Legal Injury Podcast, where knowledge is power and collaboration transforms care. If today's episode opened your eyes, share this episode with your network and help spread the word about the realities of personal injury care. Follow us on social media to keep learning and connecting with this incredible community.